Hi, today we'll be talking about evidence-based policy making. In today's session, we'll be talking about rationality in policy making, what is evidence-based policy making, increasing use of data-driven evidence, in that context big data and data analytics, and the road ahead. There are several models of policy making. Rational model seeks to learn all the value preferences extant in a society, assign each value a relative weight, discover all the policy alternatives available, know all the consequences of each alternative, calculate how the selection of any one policy will affect the remaining alternatives in terms of opportunity cost, and ultimately select the policy alternative that is the most efficient in terms of costs and benefits of social values. It would mean try to find as many courses of action as possible, evaluate all the alternatives, and take the decisions based on rationality. Though often we find that the decisions are based on political realities, political priorities override pragmatism. It is in this background that we discuss evidence-based policy making. The term EBP gained political currency under the Blair administration in UK since 1997. It was intended to signify the entry of a government and a modernizing mandate committed to replacing ideologically driven politics with rational decision making. It helps make people well informed decisions about policies, programs, and projects by putting the best available evidence from research at the heart of policy development and implementation. The pursuit of EBP is based on the premise that policy decisions should be better informed by available evidence and should include rational analysis. It advocates a more rational, rigorous, and systematic approach. We need evidence to understand the policy environment and how it's changing, appraise the likely effects of policy changes so we can choose between different policy options and subsequently assess their impacts. We also need evidence to demonstrate the links between strategic direction, intended outcomes, and policy objectives to show that there are clear lines of argument and evidence between what we are aiming for and what we are doing now. We also need evidence to determine what we need to do to meet our strategic goals or intermediate objectives, influence others so that they help us achieve our policy goals and take them through to delivery, and to communicate the quality, breadth, and depth of our evidence base to meet the open government agenda. However, there are three main issues surrounding the use of EBP. What evidence is used in the policy making process? Policies should be informed by a wide breadth of evidence, not just hard research. Key issues include the quality, credibility, relevance, and the cost of the policy. Second is how evidence is incorporated into policy making. Policy processes ideally involve different stages from agenda setting to formulation to implementation. Evidence therefore has the potential to influence the policy making process at each stage. However, different evidence and different mechanisms may be required at each of the policy stages. And third is evidence is not the only factor which influences policy making. It is important to acknowledge that at each stage of the policy cycle, a number of different factors will also affect policy. Look at this diagram. This indicates that the quality of evidence would depend on how the influence of various factors on evidence is factored in. And these evidences can be influenced by expertise and experience of the policymakers, judgment of the policymakers, resources available, habits and tradition, influence of lobbies and pressure groups, pragmatics and contingencies. A lot of thrust is being given to big data and data analytics to overcome these influences. Three themes are emerging. First, the role that institutional capacity has within the government to utilize big data analytics. Second is government use of big data analytics in the context of digital public services. And finally, the way that big data information enters the policy cycle, focusing on substantive and procedural policy instruments. Examples from the education, crisis management, environmental and healthcare domain highlight the opportunities and challenges for each of these themes. There is consensus that big data is here to stay, but ensuring its variety, velocity and veracity would be critical. However, its utilization by government may take time due to institutional barriers and capacity bottlenecks. Despite all the challenges like factors influencing evidence or constraints in utilizing big data for creating an EBP approach, There is a general consensus in the literature that a more evidence-based approach to policy and practice would be a positive development. Let's take an example of integrated disease surveillance program. This was launched in India, and its objective is to strengthen, maintain decentralized laboratory-based IT-enabled disease surveillance system for epidemic-prone diseases to monitor disease trends and to detect and respond to outbreaks in early rising phase through trained rapid response teams. Components of the program are integration and decentralization of surveillance activities through the establishment of surveillance units at center, state and district level, human resource development that includes training of state surveillance officers, district surveillance officers, rapid response team and other medical and paramedical staff on principles of disease surveillance. Use of information communication technology for collection, collation, compilation, analysis and dissemination of data, strengthening of public health laboratories, intersectoral coordination for zoonotic diseases. GIS is being used or being applied extensively in the health sector in this program as well, and the various interventions are find geographical distribution and variation of diseases, analyze spatial and temporal trends, identify gaps in immunizations, map populations at risk and stratify risk factors, document healthcare needs of a community and assess resource allocations, forecast epidemics and plan and target interventions, manage patient care environments, materials, supplies and human resources, monitor the utilization of health centers, route health workers, equipments and supplies to service locations, publish health information using maps on the internet, in locating the nearest health facility. Look at this picture. This picture is a good illustration of how effective the GIS can be in mapping diseases. This is a picture of malaria hotspot analysis in Chakradharpur subdivision of the West Singhbhum district of the Jharkhand, and you can see how interventions can be planned with such illustrative details. This is another picture of East and North Delhi hotspots for dengue cases. Again, you know which are the areas which are dengue prone. Even in the case of COVID-19, the action has been evidence based. The government prepared containment plan in clusters posing high risk of further spread based on data. Mathematical modeling studies helped support the strategy. Zoning of all the districts in red, orange and green was based on numbers reported from each of the places, and testing and medication was decided on the basis of results seen in other countries. A very useful approach for generating evidence has emerged, that is randomized controlled trials. Controlled trials can bring rigor to the process of determining what works and what does not in public policy. RCTs are the so-called gold standard of evidence-based policy. In an RCT, participants are randomly assigned either to receive an intervention or not. Since these two groups tend to be the same in all other respects, they can be compared to analyze the effects of a policy. In recent years, Abhijit Banerjee and Esther Duflo have applied this in India also, in education sector especially. It has raised the prospect of RCT as a means to help policymakers find realistic answers to questions at hand. Policymakers can be better prepared and informed when implementing a new policy intervention or when evaluating and refining current interventions. However, it would require such experiments to be conducted on a large scale for a country like India. Key to the success of the evidence-based planning process in a society as vast and complex as India are the quantity and quality of the evidence base and the way in which it is assessed, interpreted and fed into policy. While the study of evidence from research is important, it can only be used effectively to inform policy if it is contextualized, readily accessible and valued by policymakers. Last year on November 21st, 2019, Prime Minister Modi, addressing the Accountants General and Deputy Accountants General conclave, said, "Our aim is to make evidence-based policy making an integral part of the governance by the year 2022. It will also help in creating a new identity of New India." Thank you.